Public Safety Committee of Cleveland City Council please come to order? Madam Clerk, do we have a quorum? Would you call the roll? Present.
Here. Present.
Thank you, Madam Clerk. We have 4 pieces of legislation. Before I call the legislation and discuss the legislation, we're going to deal with the first piece will be 1380, 2025, as amended due to the visitors we have here from the medical institutions. But I'm going to ask the Safety Director to come to the table to briefly bring us up to speed. We know there's been a lot of discussions, a lot of issues pertaining to the extension of the flock camera system, license plate readers in the city of Cleveland. The council president and myself are in receipt of a letter from the mayor indicating after discussions, internal discussions, they've decided to take a different approach, and I'm going to, at this point, stop, and then we're going to end that discussion and move on with the legislation. Director.
Yes, good afternoon, Safety Chair and
Thank you.
Council members. You're correct regarding this flock safety. We are not going to go to the Board of Control. We have had internal discussions, deliberation. Ultimately, we are going to introduce legislation for an extension, a 1-year extension of the flock safety system. So at this particular time, we are not moving forward with a presentation.
Thank you. And if what I understand, please correct me if I'm wrong, that legislation will be submitted on June 1st?
Yes, sir.
Okay. To the viewing public and to anyone who's in attendance, once the legislation is submitted to the body, it will go through administrative review, and then I will talk with the council president, and we will schedule a special meeting of council sometime, of the safety committee, sometime in the middle of June. We're working on some dates right now, so you'll be notified, members of the committee. We want to make sure that we have everybody in attendance for that day to discuss that legislation in detail. If you have specific requests that you would like, direct those to Ubakun, and she will send that detailed information over to the safety director for a response if they can, in fact, respond to that request of members of council. So at that point, thank you, Director, and we'll look forward to the discussion on flock. Thank you very much. Thank you. Okay, ordinance number 1380-2025 as amended by council members Griffin and Polensek, Conwell and Starr to amend section 621 of the codified ordinances of Cleveland, Ohio, 1976, as enacted by ordinance number 54-74, passed March 25th, 1974, relating to menacing of healthcare workers. Before I do that, I was remiss. I wanted also to congratulate the 15 seniors from across the city who were recognized today at 11 o'clock in public auditorium for their contributions in their engagement in each of our communities. I want to congratulate my colleagues as well for their submission of the individuals. It was a wonderful group of people, so my congratulations to all of them. And I would be remiss today if I did not mention as well, today in the city of Cleveland is Little John Rinaldi Day, longtime comic legend in the city of Cleveland for his years of dedicated involvement in many neighborhood worthwhile groups, not only in the city of Cleveland, but across the region. So on behalf of Cleveland City Council, our congratulations to Little John Rinaldi for his special day. He's being honored all day today. Okay, first time reading of ordinance 1380-2025 as amended. Came in October 27th, 2025. It was referred to the various departments and divisions. It was approved by Director of Public Safety, approved by Director of Public Health, approved by Director of Finance. There's no legal objection to the legislation. Let me read two of the amendments, and they should be on your screen. We have Jennifer O'Leary here from the council legal side of our operation. Jen, are these on the laptop? Are these on the screen, the amendments?
Through the chair to the council members, yes.
Okay.
You have a legislative summary,
Okay.
a redlined ordinance with the proposed amendments,
Okay.
and there are three separate amendments.
But I still need to read them. Okay. So,
And vote on
Excuse me,
them.
Mr. Chairman.
yes,
Where's my amendment that I've submitted?
say that, I didn't hear.
Where is the amendment that I had submitted even back from December of last year and again this year?
I think there were some of your suggestions incorporated into the legislation, into the amendments. But let me read the two amendments that I do have here. Amended section 621.07A, healthcare worker means one who delivers care and or services to the sick, injured, or those receiving medical or behavior health treatment, either directly as healthcare professionals, such as but not limited to doctors, nurses, radiology technologists, emergency medical technicians, paramedics, and unarmed crisis responders, or indirectly, but not limited to aides, helpers, laboratory technicians, emergency dispatchers, or waste handlers. And then the Second Amendment amended section 621.07D. If the victim of the offense is a healthcare worker whom the offender knows or has reason to know is a healthcare worker, and the offense occurred during the healthcare worker's performance or attempted performance of an official responsibilities or duties, and if the hospital offers de-escalation or crisis intervention training for such healthcare workers, menacing is a misdemeanor of the first degree. Okay, so you should have that, and that is, Jen, you indicated that's redlined on the screen?
Yes, through the
Okay.
chair of the
Go
council,
ahead.
we also added, in addition to de-escalation or crisis intervention training, we also added trauma-informed care training for healthcare workers.
Okay.
To that amendment.
And to my colleagues, we did have a meeting, specifically a meeting which everybody was invited to discuss the legislation and to discuss proposed amendments. We did have that hearing. I do not have that date in front of me, but we did. It took place in our conference room, and everybody was invited, and I do appreciate those members of the committee who did attend that. Ms. O'Leary, would you care to comment additionally on the piece?
Through the chair of the council, in that meeting, there were some additional requests and some consensus around the amendments, and that's what these new proposed amendments reflect.
Okay. Okay.
They do need to be voted on.
Yes. So would someone make a motion with regard to the amendments? Mr. Chairman, I'll make a motion. Thank you, Councilman. Is there a second?
I'll second.
Thank you. All in favor, call the roll. Yes.
Yes.
Yes. Thank you. The amendments are approved as read. So let's get into the to the embodiment. And what is this that you have given
Through the
to it?
chair to the council, that's an additional amendment that came out of our last meeting where there was a suggestion that we add some whereas clauses.
Okay. So here's an additional amendment. Proposed amendment to ordinance number 1380-2025 to add whereas clauses. Whereas the council urges, and would someone, could you please close the door? Thank you. Whereas this council urges all Cleveland hospital systems to adopt policies that require their healthcare workers to report workforce violence incidents internally, and that make paid time off available for healthcare worker victims to report and file complaints of workplace violence with the Cuyahoga County Prosecutor's Office and seek medical and or behavioral treatment for their injuries. And whereas the council also urges the prosecutor's office to carefully consider filing charges based on a healthcare worker's victim's complaints of workforce violence, and that is it. Okay, that would go into whereas clauses. Do we have that on the screen as well? That is? Okay. Okay. So I would ask one of my colleagues to make a motion on that as well.
Mr. Chairman, I make a motion.
Thank you, Councilman. Is there a second? Second. Discussions on the motion at all?
No discussions, Mr. Chairman.
Okay. Would you please call the roll, Madam Clerk? Yes.
Yes. Yes.
Thank you. That section to the whereas clauses is amended. Anything else, Jen, that you would care to comment before I ask for the hospital systems to come forward?
Through the chair, no. I'm just here to answer questions.
Okay, thank you. If you would, I guess you could stay there. Okay.
The chair,
Yes, ma'am.
I'm again going to bring back up the amendments. So you talked about the portion of the amendments, but there is no requirement for publicly reporting this information. And that was a part of the amendments that I submitted.
Okay. Wait a minute. Hold
Well,
on.
I'll make
Yeah,
them.
wait a minute. Let her respond to that, if you may.
Through
Would
the
you care to
chair,
respond? Go
Just to clarify, that's part of the whereas clause, but you're right, it's not a requirement in
It is
the
not
ordinance.
just to follow up. So
Yes.
I did briefly, well, last night I did send out committee members. There is information as it relates to the data disconnect, specifically as it relates to adults in the criminal justice system, where that has been a report from the Ohio Supreme Court since 2018 that talked about the lack of public reporting on just data within the criminal justice system, understanding that there are desperate impacts, desperate treatment. All things are not equal within our criminal justice system. I believe it is important, when you know better, we should do better, and not having a requirement to publicly report on data and I think that should be the standard for all of the criminal justice things that we look at. But in this regard, I think it is absolutely necessary that there are public requirements. And I guess my question is, why wasn't it included, in fact, not just a suggestion, but that is a standard?
Would you care to comment?
I mean, I would just say through the chair to the council that that wasn't something that came up as an amendment in the last meeting,
Okay.
as a consensus of the
And again, everybody
committee.
was invited to participate in that
Again,
meeting.
regardless of a
Yeah.
meeting, we're here at the committee
Okay.
now.
I understand
Again,
that.
I was,
So,
Yeah.
so propose your amendment.
again, I will, okay, so.
State it for the record.
Move to amend, and I don't know the news section. I guess it will be at the end. This would be. It would have to be a news section 2. Move to amend ordinance 1380-2025, creating a new section 2 for annual public reporting requirements. Point 1, the Director of Public Safety, in coordination with the Department of Public Health, shall prepare an annual menacing incidents and healthcare settings report to be submitted to Cleveland City Council and made publicly available on the city's website no later than March 31st of each year. Point 2, the annual report shall include aggregated data of all incidents involving alleged violations under the divisions, including but not limited to total number of reported incidents of alleged menacing of healthcare workers, total number of charges filed under, number of cases where trauma-informed care, well, I'm gonna strike that one up. Geographic distribution, demographic distribution, disability status, social economic indicators, as well as the disposition of cases, including diversion, dismissal, plea agreements, or convictions. So that's my
So
proposed amendment.
to the council lady, that would, the hospital systems would make those reports to the Director of Public Safety?
No, that would be the city of Cleveland. If these are things that are happening within the city of Cleveland,
Yes.
the city of Cleveland is responsible through the various whether it's filed in a court, then yes, the city should be tracking this data, period.
But I mean, the hospital system, what I'm trying to understand with your amendment, if there's an employee at one of the institutions and they're assaulted, and there's a report made, is that institution supposed to notify the safety director or the city as well? That's what I'm not clear on.
Well, again, since the city of Cleveland is coming up with the rule, then again, there should be a standard for the city of Cleveland to track it.
Okay.
However, people feel
Do
like
you-
this body says it is necessary to create
Yes.
this law, so we
Okay.
should have a way to collect the data.
Okay, so,
Is there discussion on the
wait a
motion?
minute. I'm going to ask, first of all, there will be discussion on the motion, but I'm going to ask Jen if she has.
I guess the question is, how
the
currently
re-
is this?
The report, I'm trying to understand the reporting process.
Well, that's what I'm getting.
Yeah.
What's the current standard? And that's part of the problem is when the issue that was reported back in 2018, we do not have standards to actually track
Okay.
things, and that is a problem. And so I am offering to this
Okay.
council that we should not continue to create standards within our criminal justice system without the requirement to collect data.
Okay. So, and the problem is none of us have that, your amendment.
It's basically the section G that I, again, have submitted several times to
Okay.
this committee.
Well, again, we had a meeting specifically to talk about
And
amendments.
I had to do interviews
Okay,
for
okay.
the deputy commissioner position of
Okay.
community crisis
So,
response.
do you have that in writing, council lady, so we can
Yes.
all take a look at it? Can you print that, please? And then in the process of getting that printed, we'll have discussions. Councilman Jones, you had a question on the amendment?
Thank you, Mr. Chairman.
Yes.
We first want to thank you for, your patience in being the chairman of the Safety Committee. And we did spend a lot of time talking about this. We've had the various different clinics in here. One of the concerns that I had when I asked the question, Mr. Chairman, about how broad, how are we reporting it now? What have been the circumstances and the situations? How many assaults do we have? And at that time, when I asked that question, Mr. Chairman, the systems, our hospital systems, were not keeping track of it. So they were not keeping the actual track of what was actually happening. They were saying that these issues are happening, but we didn't have anything fundamentally that they could prove themselves to us. And so, Mr. Chairman, sitting here at this table, if we do enact this, I would certainly second Mrs. House Jones' motion, because at the end of the day, we need to have the breadth of understanding just how bad this potentially could be, and how bad it is actually happening. Because unfortunately, Mr. Chairman, our systems, our hospital systems that we have now in town, have not been tracking and keeping this information and this data.
Yeah.
Even though they made the argument about the issues and instances and situations, and one of the arguments was that a lot of their employees just get abused, but they don't report the situation, and that this here would be able to allow them to have the vehicle to be able to do that, in addition to looking at the direction of how we prosecute situations that happen where they're being victims. So I do believe, Mr. Chairman, that having the component in this particular legislation that talks about what actually happened and reporting it somewhere is important. So with that, Mr. Chairman, I yield on discussions,
thank
unless Mrs. House Jones wants to add to
Now, I
that.
just want to add that all members have received data from Cleveland Clinic, from Metro, and from UH. You have,
This is new information?
it has been directed to all members of the committee. And so, Ubakun, that went to all members?
Yes, it
Yep,
did.
yep.
I see it
So,
right here in
yeah,
our
so
in our
all
piece.
members have that. Now, what I'm trying to understand, I'm trying to figure out, I want to streamline this process. So, should it be where because you'd have to go to the police prosecutor. The complaint would have to be made at the police prosecutor's office. Should the requirement be that the police prosecutor office notify the safety director, notify city council? I'm trying to figure out how we can streamline this and make it more understandable. Where the hospital, where the employees go to the prosecutor's office, they would file that complaint, and then as Ms. Jones, House Jones indicated, a notification. Should we incorporate a requirement where the police prosecutor then would have to notify us, would notify the council and the safety director? I'm looking for your thoughts.
Through the chair to the council, I don't have the written amendment. I don't
Okay.
know, is it exactly like Section G of the trauma-informed care checklist?
That's separate. That is the annual requirements. That's separate.
Okay, I don't have the
Well,
written.
that's what it is. It's cheese, but the checklist is that was a separate component.
Right,
That people
but-
didn't want to do, so.
You know, we're hearing this for the third time, and I want to, and we've had the session where anyone who has concerns, and again, I understand people had other commitments that we couldn't attend the discussion we had, but I want to get moving on this because there are people that are at risk in our city. There are healthcare workers that are at risk. I understand the reporting suggestions as it pertains to reporting, and I want to make it streamlined. I want to make it clear so people understand. If a healthcare worker is assaulted, and there's a report made at
But
the
this is not about
prosecutor-
assaulting. This is about menacing.
It's about what?
This is
Menacing.
menacing.
Okay, I
This
understand
is not
that.
about assaults.
No, I'm aware of that.
But-
But I want to be able to get so people understand what the process is, so it's clear and concise. So we're waiting for our stuff to come back.
No, I'm saying currently, what is currently done within the city of Cleveland for public safety to track data?
Okay,
How do they currently do it? This is just another element to,
okay. Well, then
what they should
there
currently be
has to
doing.
be a reporting process. Who
Correct.
they're going to report to. So I'm trying to figure out, should they report to the
how, again,
law?
if there's,
Go ahead.
if there is someone, we are saying that things should be going through a court system, that is the reporting process, correct?
Yes.
There is a legal definition of it. Charges will be filed and action will be taken. So again, currently, how does the Cleveland Department of Public Safety currently assess and track other crimes in the city of Cleveland? That is the process.
Mr. Chair?
Yes, wait a minute, chief.
Can you bring you have the safety director. He could explain the process.
Yeah, wait a
It
minute.
is on, it's on.
Through the chair. Director Drummond, would you please come to the table, sir?
Thank you, Mr. President.
Thank you. Thank you. And I'll ask the director, because you understand the piece, because you folks approved the piece. Are you aware, is there any reporting system that you are made aware of where there is Metro, UH, Cleveland Clinic, any other medical institution? Are you notified in any capacity?
Through the chair, to the council members, it depends on the situation.
Okay.
And also, again, it just depends on the situation, but there are reporting requirements relative to crimes that are committing here in the city of Cleveland.
Okay. So what's, in the handout, what section are we looking at? G?
It's Section G.
Section G. Section G.
That's the
Okay,
the
annual
last page.
reporting requirements on page,
Last
okay.
page. The last page.
Look at, yeah, Section G. So all members should have this. Do you have it? Jen, do you have this? You're getting it right now.
Through the chair, I have what was proposed a long time ago, along with a trauma-informed care checklist, and this was part of it. I guess my question, is it exactly the same as what is here?
Yes, that's it.
Okay. Well, because it references the
Yeah,
trauma-informed
but
care
wait a
that's
minute.
checklist.
that
Wait a
wouldn't be
minute.
applicable.
That's okay.
Clerks indicating that the citizens cannot hear, so please bring your mics close and talk into your mic. Thank you.
So for clarification, Mr. Chairman, we're talking about G, where it says annual public reporting requirements.
Yes.
I don't see a problem with this. This is a no-brainer. What's the holdup?
Wait a minute, hold on. Okay, Councilman Starr, and again, please go through the chair. Thank you, sir.
Yes, Mr. Chairman. within the approach that my colleague, Councilwoman Stephanie House Jones is doing is saying is, if we're going to pass 1380 2025 with this whole overall approach, how do we ensure that this ordinance is actually working, and how do we actually get data on an annual basis of what is actually going on? We did see from Cleveland Clinic, Metro, and University, they were able to provide some data to
Yes.
us. How do we get that type of data on an ongoing basis, on an annual basis? So the city of Cleveland has it, and at a request of the council, we automatically get it as well. So from that standpoint, I know how we got this data from those 3 healthcare institutions, but how do we make it to a system that is streamlined for us to be able to have this information readily available at any given time on a reporting basis? So through the chair to the director as well as our attorney, how do we put this as a requirement as outlined in Section G, annual reporting requirements to be added to 1380 2025 is the best thing. They show that they can do it, but how do we make sure this be something that's ongoing? Through the chair.
Would someone care to respond to that? Either director or Jen? I mean,
Through the chair to
I
the
guess
council.
the question I would pose, are we aware, and just right to the point, are we aware, outside of the first time getting these statistics that we requested as a result of this process, has CPD, has your office been aware of these numbers? Is there any type of reporting at all?
Through the chair, we do have requirements that when a criminal act takes place in the city of Cleveland,
Right.
that report is made.
Okay.
So there's a requirement. I have to double check with the Division of Police to see if those reports are going directly to us or they're going directly to the prosecutor's office for consultation and potential prosecution.
But that would be general, but specifically with
Oh,
regard to
specific to this?
healthcare workers.
Specifically to this, I don't have that
Okay,
information.
okay, then you answered that. Jen?
Well, through the chair, then I guess the language, it says, it puts the onus on the Director of Public Safety in coordination with the Department of Public Health. It seems that they may need to get some information from the prosecutor's office
Okay.
and potentially from the hospital systems,
Okay.
correct? But
That's correct.
Okay. So, then that being said, where would we incorporate a reporting provision within that section being proposed by Councilwoman House Jones? Would we incorporate the Cleveland Police Prosecutor's Office shall report?
Well, through the chair, if the Director of Safety is okay with it just remaining Director of Safety, he can get that information from
fine with
where
that?
he needs to.
Through the chair, yes.
Okay,
I
He's
would
fine.
point out that it would be best to propose this conceptually. There's probably going to need to be some language that's changed in here.
yes.
Due
Well, it
to
has to
things
still
like,
go-
it references the
it's-
trauma-informed care
it's-
checklist, which is not
Which one was that?
in the ordinance.
Yes.
I didn't read that.
Listen,
Okay.
I didn't read that.
Okay.
it's still going to have to go before finance, okay, the
So,
legislation.
so which one are you talking about, so I'm on reference, I understand? Which,
Through the chair, Councilman Jones, what was your question?
No, just got explained just a minute ago. The question was the number of cases where the trauma-informed care checklist was completed, including findings, but Mrs. House Jones is just cutting that, so it's not going to be
Okay,
included.
so
Okay.
that's not included.
Okay, so as
fine.
long as we can get a copy of what was
Okay.
read,
So
that
do
would be
all my
helpful.
colleagues understand what's being proposed? Now, there's one other, there was, the law department just made in the whereas clause that we read earlier, that in the third line, which is redlined, workplace violence incidents internally, and take out that, it should be two. So that should be removed, it should be two. Okay? So if there's, and I'm assuming I'm gonna have to, because we read it, we're gonna have to make an amendment to that. So I wanna make sure, in the whereas, new whereas clause,
You don't think so?
again, where it says workplace violence incidents internally, and that should be stricken, and two, TO should be incorporated. Is someone make a motion to that effect?
I'll make a motion,
Okay,
Mr. Chairman.
second? Okay, all in favor?
Aye.
Aye. Okay.
And so now, Mr. Chairman, I have a question.
Yes, sir.
And I ain't trying to open up any
Don't
can of
open up
worms
any
here.
worms at this point,
But,
okay? Because,
and I'm quite sure that our attorney should be able to
yeah.
have this as a part of this. Do we have anything in this that will also, are we reporting any kind of menacing incidents as well on patients who are coming to the hospitals? Would this also work both ways? For those patients who do come to the hospital, they are in conditions where that is happening to them as well.
Who are you directing that to, Councilman?
Probably safety director.
Safety Director?
Through the chair to Councilman Jones. Can you repeat that? I'm not sure if the
Well,
question.
we're sitting here right now finna pass this piece off, and this piece is pretty much saying, hey, we want to make sure that we're reporting these incidences, we're prosecuting these incidences where healthcare workers are being menaced and abused. Is this reversal too for those who are patients, those who are customers who are coming into the hospital? And you know, when I was here last time, I talked about some of the conditions of our hospital facilities, how nasty they were, how dirty they were, and
But
how
that
they
has
didn't
nothing to
have.
do with this.
But there's still an abuse to customers coming in, and its impact on them
Okay.
coming into an environment where you have uncleanliness, and
Okay.
and these people are sick, and you'll have people coming in there cleaning up the
Okay.
vomit, the feces, the urine, and I've experienced that, Mr. Chairman.
Okay, but
And
Councilman, that has
so what
nothing
I'm
to do
sharing
this
with you
piece.
is I experienced it
Yeah,
as a
okay.
customer, and so my family experienced it as a
Yes.
customer here in our city.
Okay.
And I reported it. So now the issue that I'm asking, Mr. Chairman, to are not open up any worms here, but is this reversal in the same if that happens to someone who's a customer, who's
Through the
coming for
chair-
health
through
care?
Who
the
can
chair
ever
to the
answer
councilman, that is not included in
Yes.
the amendment as I heard it proffered.
Okay.
Okay.
Thank you.
Through the chair, if I
Okay,
can,
should
and
we,
I'll
should
be
we, wait a
include
minute,
it?
wait a minute. Go ahead.
Through the chair, it was as stated, it was not contemplated in this legislation. However, everyone has a right to make a police report if
That's
they
right.
feel they're threatened, menaced. So I'm sure that each of the hospital system have procedures and policies in place for that as well.
I got that, but that's the reason why we're putting this here, because apparently the people who are being menaced could also do the same thing as on the opposite side. But yet we still taking the time to have 3 events, to have a number of sessions and meetings. So we also have to think about the customers who are also victims.
I want to ask you one quick question.
Okay, wait a minute.
Through the
Thank you.
chair to Councilman Jones, understood.
Thank
Again,
you.
there are policies in place for the hospitals to take care of the
Thank you.
patients who feel that they were threatened or menaced as well.
Okay, I have Councilman Slife, then Councilman Conwell.
Thank you, and I'm glad the director came forward. I understand the spirit of the amendment, and I think it's valuable to have data. I think the struggle that I have is understanding how these data are received, because once again, and we talked about this at the last meeting, if I am an employee of the Cleveland Clinic and I feel menaced, I don't need permission from the Cleveland Clinic to file a police report against somebody. The Cleveland Clinic may have no knowledge of me having done so, and it seems that it's useful that the hospital systems have provided data to us to give us a sense of scale. However, the way that I'm interpreting this or trying to understand how it would be conceptualized would essentially require employers to have direct involvement in a lawsuit that otherwise they may have no involvement in. I may not want my employer knowing that I'm filing charges against somebody. I do not have to tell my employer that they're filing charges against somebody. And I guess the question I'm building to the Director of Public Safety is, and I guess in coordination with health, is how these data would be gathered within a police report. Would and are, like, when we start talking about like socioeconomic status and primary languages, it seems like it's useful information, but it's beyond the ability for the police to, one, gather it, and 2, I worry that the level of information needed to file a report becomes discourages people from filing a report. I don't know the background information of the person that I'm accusing of menacing me. I just know that I felt menaced, and I want to exercise my right to hold them accountable under the law. How would these data be gathered?
Any comment?
Through the chair to Councilman Slife, that's a good question. It's something that I can't tell you right now. It's something that we have to sit down and talk through. It says here in cooperation with coordination, rather, with the health department, Dr. Margolius. I would have to sit down with them, obviously healthcare systems and so forth. And it is a lot of data points that you're talking about here. Again, that's something that's being required of this legislation. And again, it's something we'll have to sit down and talk through.
Point
Okay.
of information.
Wait, yes.
Again, when you go on, again, this has nothing to do with the healthcare systems. When you call and you file a police report, now, through the chair, what do you people have to currently do when they file a police report? What information is required of people?
To the director?
Provide their information, their name, and some other things, and also what transpired and what happened during the
So
incident.
do you ask people their age,
Sure,
their
that's-
address,
Through the chair.
gender,
Council. Yeah,
race?
absolutely, all those
So
things
these
are part
these
of it.
things are currently, when you file a police report, these things are currently asked for, correct?
Through the chair, Councilwoman, yes, that's
Okay, all right. And then when there's another public system, like in this list from one of the hospital systems, it says police calls for service only, prosecuted events only. The information is there. What I am asking is people are already filling out this information. It is making sure that it is collected and we are reporting it publicly in an aggregated way following HIPAA.
Thank you. Thank you.
I-
Okay, Councilman Slife still has the floor.
And respectfully, I think where I'm struggling is, I know my age, I know my gender, I know my race and ethnicity and all of these other things, but I believe the spirit of gathering data is to ensure that we are not victimizing people who in this relationship are being categorized as perpetrators. They are the person who perpetrated the menacing against the victim, who is the healthcare worker. And I don't know any of those details about the alleged perpetrator to share while filing a police report. And I don't know how those data are easily gained by the city of Cleveland, whether it be a city department or even in perhaps within the more formalized judicial process. So it would be very useful information to understand that the person I'm accusing of menacing me is in a state or condition that is maybe they're not being able to advocate best for themselves, or that we're just able to track some sort of broader trend that we would identify as problematic. But that seems to be something that would happen through the court system and not in the taking of a police report that I would then take to the courts in an attempt to file charges against my alleged perpetrator.
That's not what this says.
But through the chair.
Through the chair, that's not what this says. This was an annual reporting. This does not say anything of what the process needs to look like when you are filing your report. Again, when you're talking about getting the information from prosecutors, that should be information that is happening. And the reason why this is important is because when you have a criminal justice system where all people are not treated the same and fairly, you need to be able to document it, who actually is being prosecuted versus who isn't. That's the reason why I'm putting forth this amendment.
I agree, Mr.
Because
Chairman.
all people are not treated fairly in our criminal justice system. And if you do not take the time from the prosecutors to get the information, you never know what the trends are. Who's being enforced upon and who is not being enforced upon. And that's why this is necessary.
And everybody in this
again,
room knows
excuse me,
that.
hold on.
Listen up through the chair.
And I'm bringing this back up. And the reason why I'm highlighting the report, Data Disconnect, from the Ohio Supreme Court is because, again, we as the state and we in the city of Cleveland are not collecting it. And I think it is vitally important for us to start coming up with clear processes to be able to do our own analysis so that we can ensure that there are not disparate impacts, intentionally or unintentionally.
Thank
And
you.
if there are, we should be able to do something about it.
Thank you.
Again, this is an annual reporting. This does not say that this has to be done from a
Okay.
person who is following a police report. So I just want to put this clearly so that people are not saying this is what we're requiring of victims. That's not the requirement.
Okay, thank you. And again, I would say to my colleagues, let's follow proper protocol Councilman Slife still had the floor, so I want to just say, and then Council Conwell had a question, is on the list as well, Councilman
Put me on the
Slife.
list, Mr. Chairman.
Okay, I'll put you down.
Thank you. And again, I'm not debating the value of data or the systems in which people are mistreated and our needs to resolve those structural inequities. But to the chair, I cannot support this amendment because the departments of public safety and public health are not the keepers of those information. That is information coming and being gathered by prosecutors. And I'm not an attorney, I play one on TV, but I'm not confident that the prosecutors are able to share with another city department the information being provided here about does that violate victims' rights in other ways. So I understand the value of it. I'm struggling to understand how this can be operationalized, and I worry that even if it can be operationalized, it becomes so cumbersome to go through this process that we end up right back where we've started, which is there's an issue of hospital workers being menaced and people not being held accountable for having done so.
Thank you, Councilman. Councilman Conwell.
Thank you very much. I want to ask this is an annual report through the chair to the councilwoman, correct? Correct?
Yes.
So, through the chair to the safety director, I don't like waiting annually because with legislation, things can change. I'm not trying to change this to quarterly, but if you see a change, Mr. Chairman, let's say on a quarterly basis, then
Yes.
someone should let us know, and then that way you can move into another direction, not outside of the legislation. But sometimes things change up through the chairperson to the safety director. And I get that, Councilwoman. I know what you're trying to measure
Yes.
and put systems in place. I understand pre-testing, post-testing, but I don't like to wait annually, especially on something that is new, through the chair to the safety director. Sir.
Through the chair to Councilman Conwell, we go by what is required of us.
Right.
If it's a quarterly report, we'll provide a quarterly report. If it's an annual report, we'll require
Director,
that.
you have to speak louder.
I am.
I'm hoping that
My mouth
mic,
is
is that mic working?
Yeah,
I don't know what it is.
Yeah,
What's
it
wrong
is.
with
It
it?
My
is.
mouth is right on
So-
it.
So green
Can you
light
give him a
is,
different mic? Because I know
diminishing
he can
here.
talk, Mr. Chairman.
Okay, let him,
You know,
let him.
Yeah.
Is this better?
Joe Funny.
Yeah, it's better. Go ahead.
Joe cracks me up.
Like I said, we will go by what the requirements are of the legislation. If it's a quarter,
Listen
if
up
it's
when
a
you finish.
quarterly, we'll provide. If it's annually, we'll do that as well. And as I'm
Okay.
looking through all the amendments, there's a lot of requirements here, and there's a word that said "shall," which is not discretionary in nature, and some of the things we just don't capture. When I say we, the Division of Police, we just don't capture in our reports. Maybe the prosecutor's office captures some of these things, but Division of Police, when we make reports, we just don't capture some of the information that's being asked for.
Okay. So, Councilman Conwell?
So, Mr. Chair, through the chair to
Yes.
the director. So if you see something changing, or if you see a trend that Councilwoman just narrated to you, you'll wait until an annual report to tell us, and you just won't say, wait a minute, let me talk with the chair. I see something in the third quarter or the fourth quarter. I mean, that's what I would do.
No, to the chair, to Councilman Conwell. No, that's not what I said or indicated. What I said was, if it's a requirement for us to report annually, quarterly, we'll do that. However, if there's a trend that we see based on the data and we analyze the data, yes, we'll do something about that trend.
Okay.
Great, because
Thank
you know, Mr. Chair, you could do prevention with this piece also, if you
Okay.
see the trends that the councilwoman just narrated,
Okay.
and we can do that.
Okay.
And that's where I'm at, and I'll close on it.
Thank you, Councilman.
right.
Councilman Starr.
Thank you, Chair. One of the things that just keep coming to the back of my mind as we are having this discussion is this ordinance is being brought to us more so under the lines of healthcare system of reporting threats, assaults, and workplace violence against healthcare workers, and increasing existing penalties may not be strong enough to deter offenders, right? But at the same time, if we have workplace culture not being addressed, no matter what we pass today, it's not going to address that issue. So within context of reporting, my question would be to the director, to the chair, is what is the reporting relationship currently on an annual basis, quarterly basis with the Cuyahoga County Prosecutor Office? Do you have any annual reports that get sent to you, or are you able to get things per your request on whenever you ask for something from the Cuyahoga County Prosecutor? How does that currently work with your relationship working with the Cuyahoga County Prosecutor Office?
Director?
Through the chair to Councilman Starr. It's a good question. We obviously have a working relationship with the prosecutor's office. They have the reports. If we request the information from them, they provide it. There's nothing that we have formally, but if we require information from them, they provide the information that's requested as long as they can release it.
And then from that question, from that standpoint, through the chair to Chairman of Health and Human Services, Chairman Councilmember Conwell, do you have that same working relationship with the health department? And if you needed something to escalate to anyone else from the county, are you able to get information that you request as well? Do the director of the health department have that same luxury if they needed to get information from the three healthcare systems through the chair?
Well,
Wait a minute. You had to make,
No, she's asking.
I was asking the chairman, I was asking Councilman Conwell
it's
that
health,
question.
okay,
From
Council.
health standpoint.
But as you know, I don't have any problems getting anything from the county. I could get
Okay.
it from the county. Is that what you narrated to me?
Thank you.
I just pick up the phone and call and
Thank
get
you.
it done.
Thank you.
So if we're hearing clearly that if the safety director can make a request to the county to get information on an annual basis or whenever they need information, they have a working relationship when they are able to get that. And if we're talking about we need some reports from the healthcare system, and we're hearing the chairman of the health services said he's able to get that information through his committee as well, then what's the confusion of us putting in this amendment that Councilwoman House Jones has narrated repeatedly, that we need to make sure we're not just passing something just so we can get our names in the paper that we did something? If we're going to address the issues that is affecting these healthcare workers, and for us to understand who's being charged or who is they're going after, we need to make sure we have reports so we can understand the trends and also understand any threats that are occurring. So I definitely would love to support this amendment, and I do so wish that we can get that moving forward, because us acting like this is a big problem as if we're not the ones making this a law or making the changes. And if we can't ask and request something, then we shouldn't be here having this discussion at all. So through the chair, I just wanted to put that out there that I do support this amendment that Councilwoman House Jones has put forth. And if you need a second, I guess, I will second it. And I think we should call a vote and say, let's add it the way it needs to do and stop bickering like we're just some little children and don't understand what we're trying to do.
Okay, listen, through the chair, yes, you had a question, Councilman, yes.
You know, one thing about legislation, when you put it in place, and this is new here, I think that you have some kind of mechanism when you see it, you evaluate it to the chair to some kind of evaluation process. And then we can always come back and amend it because it's new. Okay. It's new. And you might see some things that we might need, that we might not need, whatever the case may be. But the bottom line is to the chair, to the council member, it's an evaluation process. And you know that very, very well when I talk about that. Because you can't just push legislation or policy and you have no systems in place to evaluate it.
Yes,
Okay.
but point of
Let-
information.
wait a minute.
No, a part of the amendment, it does says the report, this is regarding the annual report. The report shall also provide recommendations for system-level improvements, including policies, training, trauma-informed practices, staffing protocols, and resource needs. That is a part of the annual report
Okay,
and the
thank you.
amendment that was presented.
And so, again, I want to say to people, if you're not going to go through the chair, then you're not going to be recognized.
I went through you.
Okay, I know you
Mr.
did,
Chair.
you did.
Yeah.
Councilman Slife, and then we're going to get into this amendment. You want your, you'll be the last one to comment, then we're going to go down line by line on her proposed amendment, and then we're going to vote on it. Councilman Slate and then Councilman Jones.
Sure, and I just want to underscore my belief that the data being sought here are not data that the police gather. It's data obtained during pre-sentencing procedures within the courts. That information is held by judges who do not have to give things to this body as a co-equal branch of government. And my understanding is those reports are not public data unless someone is prosecuted successfully. So again, I'm not saying that there's not value to us knowing these questions. I'm rather pointing out that it is functionally unknowable in the moment when somebody is attempting to file a report that they could take to the courts, and that within that process, we cannot legislate the actions of a co-equal branch of government.
Thank you. Councilman Jones, and then we're going to get into the actual amendment. Council.
I think that our legislative body has the capacity to be able to tell. Thank you, Mr. Chairman. Our body has the ability and capacity to set the rules, the laws, and the policies. And so therefore the administration has to follow those rules, regulations, and policies, procedures, and processes that we sit here and legislate. And as we heard the testimony earlier, Mr. Chairman, as I remind our colleagues here, is that the safety director has stated that he would have to get with the law department to put together whatever that system and standard of accountability is. Now, if we're going to sit here and say on one side that we should have these reportings and that they should be prosecuted, and also, Mr. Chairman, that we should make it a penalty by law, because that's what we're doing here right now. We're passing a piece of legislation that's saying, hey, if someone, if a healthcare worker reports workplace violence incidents internally and the city is saying that, hey, they should get time off, that they should also report and file the complaints and of the violence in the workplace, and that the city's prosecutor, so that's the city of Cleveland's prosecutor office, and medical and behavioral treatment for their injuries. So, Mr. Chairman, I see nothing, and I'm not opposed to the simplistic request that has been served at the table by Mrs. Stephanie House-Jones. I'm in an agreement with it as Mr. Starr. And my suggestion is, Mr. Chairman, is that we hasten this and let's pass this and keep it moving.
Well,
this is not that difficult.
Yes, and then we're going to move. We're going to go over the section G.
Yeah, so some of this information is publicly available through the chair.
Already.
Age, gender, race, and ethnicity, these are publicly available information that are part of every police report that is filed. Some of it is not part of publicly available information. So my suggestion would be for the amendment to include publicly available information.
Okay. So let's. Okay.
And
So
I'll end there.
Okay. You all have the Councilwoman House-Jones' recommendations. She's indicated section G. So let's go through it very quickly. You all have it in front of you.
Through the chair, can
yes.
I ask a clarifying
Yes,
question?
Go ahead.
We have section G in front of us that was from the amendment that was proposed a while ago about relating to the trauma-informed checklist.
Yes.
I believe Councilwoman House-Jones stated here that it's not, what you read is different, slightly
It's not.
different.
No, it's not. I was saying
Okay.
that I
Okay.
didn't, I'll just read. I took out the trauma-informed care checklist. I didn't
Okay.
read that part because it's
Okay.
not applicable, right?
Okay.
That's on the
Right.
first part.
Okay,
Then in the
let's do the
second
chair.
part, the crisis-related factors indicating that I took that part off because that's not
Okay.
applicable.
Okay. So we
Okay.
have section G in front of us.
That's,
being
I read
proposed.
all. I read everything
So-
with
Right,
the
I just
exception
wanna
of the
be
trauma.
clear.
Okay, listen
Through the
up,
chair
everybody.
on what is different, what you read, than what is
Okay,
here
so we're
in
gonna
writing.
go over it. We
So
have,
everyone
because we have
understands.
other legislation before us as well. Okay, section G reads annual public reporting requirements. Okay, everyone understands that? Okay.
We want that in there.
Okay. Number one, the Director of Public Safety in coordination with the Department of Public Health shall prepare an annual menacing incidents in healthcare setting reports to be submitted to Cleveland City Council and made publicly aware on the city's website no later than March 31st of each year. Okay, we're aware of that. Is there anyone opposed to that?
No, Mr. Chairman.
Okay. Number 2, the annual report shall include aggregated data for all incidents involved alleged violations under Section D, including but not limited to number of reported incidents of alleged menacing of healthcare workers, total number of charges filed under Division D, number of cases where the trauma. So you're taking out number of cases?
Yes.
That's totally coming out, what you're proposing. Okay. Then we drop down to healthcare settings involved, e.g. hospitals, EMS, community clinics, behavioral health facilities. Okay, that's included, correct?
Correct.
Okay. Geographical distribution of incidents within the city of Cleveland, demographic data of the individuals involved, including age, gender, race. Okay, that would be in any report anyway. Okay, and then we're going to wrap. Okay, then
That's it.
primary language, disability status where applicable and voluntarily provided. Social economic indicators, including housing status, housed, unhoused, transitional, unknown, insurance status, insurance, uninsured, indicators of financial medical hardships when known. Okay. Crisis intervention, crisis related.
That section out.
You're taking out crisis?
Yep,
So that whole section
that whole section.
is
goes
coming
to
out.
de-escalation.
Okay, so you're taking out mental health, all that other stuff. Okay. That whole section's out.
All the way
And
down
then
to
we're going down
communities.
and we're ending, and we're going to end. So use of de-escalation practices, is that coming out?
Oh, I mean, no, that can stay in, those two points.
Okay, what about disposition of cases?
So that's publicly available. Yes.
That stays in?
Yes,
And then we're going to stop at 3?
no, 3 and 4 are included.
3 and 4 are included. Okay. So, Jen, you have that, you've seen that? Okay, on your doc, okay. Okay, so we've seen what is being proposed. And this would be an amendment to include into the existing legislation. Jen, do you have a question or comment?
My only comment, now we all understand what the amendment is in writing, and my only comment through the chair is that this would be letter F in the
Letter
ordinance.
F. Okay.
To help the law department out, they would
Okay.
figure that out on their own too.
Question, so we've read the amendment. Questions on the amendment before we call the roll.
No questions, Mr. Chairman.
What's the question, Mr. Jones?
No questions.
No questions. Any other? Okay, call the roll. No.
Yes.
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 The amendment passes, so that will be incorporate that into the piece. Okay, we have the 3 medical institutions that are here. Would any of them care to comment as briefly as possible? UEH, Cleveland Clinic, and Metro are here. Any additional comments? My only comment to all 3 medical institutions, and we discussed this in our previous meeting, is that it is our position, the council's collective position, that any employee who is assaulted or is menaced, that the hospital should be supporting them in their complaint, and those individuals should not have to use their personal time to file a complaint. And I don't care if anyone would care to comment of the institutions, because I've been informed that if an employee wishes to file a complaint, they have to do it on their own time. Wow. And that is totally unreasonable and unacceptable. That employee should be transported to the prosecutor's office by the institution, whether it be the 3 institutions in question, should be transported and should remain with that employee when they file that complaint and then brought back to the institution, or if they're going to go home. And I want to state that for the record, because to me that's a workplace issue. No employee, I want to repeat, no employee, and the council president and I have talked about it, no employee should have to take their personal time, their vacation time, if they are a victim, to file a complaint with the prosecutor's office. To me, that's absolutely outrageous. So I want each institution and any other institution that is here in attendance to understand that that's our position. And if we have to take legislative action on that specific issue, we will. We will take legislative action if we are required. If we are informed by their collective bargaining units and their employee unions that they are not being treated respectfully, then we're going to consider working with the law department, figuring out what type of corrective action we can take. Okay. Without objection, yes. Who? Oh, excuse me, Care Union. Care Union, where are you guys? Come on up. You want to briefly say something? Are you in support? Yes, that's what we want to hear. I appreciate it,
Mr.
Councilman
Chairman,
Starr.
I want to add a comment too to our hospital organizations that are here.
Briefly, come on.
Briefly.
Okay, go Councilman Starr and Jones, and then we're going to move on. We got other legislation.
Yes, and I did prepare some questions that I did want to ask for this to our three healthcare providers, because they did provide some data to
Yes.
the members of council. And some of the things that I definitely had some concerns was when you look at this ordinance and you look at some of the things that they outlined it, right? This ordinance would amend Cleveland menacing law so that if someone menaces a healthcare worker while the worker is performing duties, the offense increases from a 4th degree misdemeanor to a 1st degree misdemeanor with a mandatory minimum 3 days jail sentence. But then when you look at the data that you get from all three healthcare providers, it's alarming. You know, you got Cleveland Clinic reported that about 1,201 workplace violence events in 2023, 1,564 in 2024, 1,652 in 2025, and 603 through April of this year. But only a small number became prosecuted cases. When you look at Metro, they reported 144 incidents from 2023, 2025. They had about 85 assault charges and 11 menacing stalking charges, but could not isolate Cleveland or anything by any locations. They just said that was taking place, and they have a countywide healthcare provider. Then you got UH reported there about 14,416 workplace violence-related calls for service from 2023 through 2026, but they only have 10 menacing reports from 2023 to 2025, with only 2 referred to any prosecution. So my biggest concern is, will 1380-2025 actually protect the workers, or will it just increase penalties in a small number of cases that already make it to court?
And who are you?
I would like for the healthcare people to tell us, the healthcare providers. They're the ones who brought this before us, and they're saying that they have this issue. But when I'm looking at this data, you know, there is a big issue in the gap between reported workplace violence and actual prosecution. Cleveland Clinic had thousands of reported workplace violence events, but only 14, 16, 20, and 9 cases was presented from 2023 through 2026. UH had thousands of response calls, but only a handful of criminal level menacing reports. So my question is, what we passed today, is it actually going to solve the issue, or is this mainly an issue that they need to address in-house with themselves by making sure they have proved prevention, accountability, or workplace culture change, as opposed to us just passing an ordinance to say we're going to make the penalty more harder, which is a headline and is not actually helping address the issue with workplace culture. So what are they doing on a workplace culture that's going to ensure that this ordinance matches up to what they are asking us to do?
So would anyone from the 3 institutions care to comment? You are here in attendance. This is your opportunity to respond to the councilman's questioning. Anyone from any of the institutions care to respond?
Distinguished gentleman.
Okay. Would you come to the table and identify yourself, please? And as briefly as you can, because we do have other legislation. Thank you. Identify yourself, sir.
Thank you, Chair Polensek and members of the committee.
Pull the mic because they cannot hear.
Thank
Okay,
you,
go ahead.
Chair Polensek and members of the committee. Identifying myself, Jason Pertz. I'm the Chief Operating Officer at University Hospitals, Cleveland Medical Center. Through the chair, to Councilman Starr, to answer your question directly. We agree that we have our own opportunity internally, and I wanted to highlight those here in front of the committee. We believe that we've established best practices in managing these types of scenarios, which is why we're at the table today to highlight that work. We've established a zero harm tolerance policy within our organization. We've clearly defined workplace violence, physical assault, verbal threats, harassment, intimidation, menacing. We communicate zero tolerance stance within our organization to staff, patients, and visitors. We include expectations and consequences in our policies and signage throughout our entire enterprise. We conduct regular assessments related to this work. We evaluate high-risk areas ongoing and annually to report any and all situations. We identify those high-risk areas. We provide behavioral health support. We also provide additional support in areas of our waiting room and triage that are considered high risk and gaps for security. In addition, we implement environmental and security controls. We control access points to our organization. We secure visitor screening. We've installed panic buttons in the appropriate areas. We secure nurses' stations, barriers, glass, etc. We provide adequate lighting not only on the campus but around the campus through our parking, etc. We arrange as detailed as arranging furniture within our organization to keep our caregivers and the patients, the thousands of patients that we serve. We provide video surveillance. We provide badge access for our caregivers only to high-risk areas. We provide real-time assistance. Importantly, for this committee, we provide de-escalation training for 100% of our caregivers. That is a requirement. That is a core requirement for all caregivers, not just an isolated group, but all of our caregivers. We recognize early warning signs around agitation, pacing, and verbal escalation so that we can provide the medical care to those we serve. We also look at personal safety strategies. How do we activate our response system? We've developed a rapid response protocol at Cleveland Medical Center. That includes a behavioral response team that is on site and active 24/7, 365. This is new based on the activities within our organization and the thousands of reports that Councilman Starr highlighted. In addition, we have created and are continuing to build upon a non-punitive reporting culture that allows anonymous reporting for our caregivers. And lastly, we provide support after incident, which includes time off for our caregivers. We have a highly engaged and a multidisciplinary team of leaders that include executives like myself, up to and including the CEO of our organization, Dr. Cliff McGarrian, human resources, safety and security, UHPD, our nursing executives, as well as behavioral health specialties to help support those in need. Ultimately, wanting the council to know and appreciate that we take workplace violence seriously, and we're looking for ongoing collaboration support with this amendment. We obviously coordinate with law enforcement through the city of Cleveland, through our own UHPD. But do want to highlight, we've been what we consider an anchor organization to the city of Cleveland for 160 years this summer. And we want to build upon that for the next 160 years. And providing a safe environment for our caregivers is critical.
Okay,
Not-
let me ask
Mr.
you.
Council, one more statement.
Go ahead, and then I'm going to.
I've been a nurse for
direct the question.
27 years. 27 years. And this is critical to our caregivers.
Okay, let me ask you this.
Thank you.
And I appreciate your testimony, and I would hope the other institutions would care to comment as well. If I'm an employee of UH and I am menaced and I am concerned about my welfare, do I have to use my own personal time, sick time, vacation time to go to the prosecutor to file a complaint?
We have time off dedicated to these events. The details of that extended time, Mr. Councilman Chair, I don't have today.
Okay, but what you're telling us, I want to make this clear. You're telling us that that individual does not have to take away from their own time, their
Yes,
sick
sir.
time. They don't have to.
They don't have to.
Okay, that's what I want to hear, because we have been communicated, some of us have been communicated by healthcare workers who said that's one of the reasons why the numbers are so low, because we have to use our own personal time or our sick time to file a complaint, and we do not get the support from the institutions. And I want to drive that home. We expect the institution to support the employee. So I'm going to stop there, Councilman Starr. You have a
Mr.
question?
Yes.
Wait a minute.
Thank
Go
you.
ahead, Councilman.
So, through the chair to Mr. Jason
Pertz.
Pertz. Thank you for your comments and your remarks. So my question would definitely be then, are healthcare workers unsafe because of the current penalty is too low, or is because cases are not being reported, documented, charged, or prosecuted? Is the issue weak penalties or lack of prosecution? Through the chair to you.
Through the chair to Mr. Councilman Starr. It is our belief, as I highlighted in our best practices 8 bullet point, that it's all inclusive. We feel that we have opportunity to build that culture, to build upon the standards that have been set forth, including the legislation that is being voted on today.
Thank you.
So,
Councilman?
so to answer that question, yay, nay?
Yay.
Yay. So yes, you think this ordinance will be able to help address the fact that the penalty is too low and that now we can charge people to that first degree misdemeanor, and using this ordinance, it will be able to support that you're going to be able to convict, or not convict, charge more people.
Yes, sir.
Good.
Thank you.
And then
Go ahead.
And then, because the reason why I'm looking at it, if this ordinance was in place, 1380, 2025, during 2023, 2024, and 2025, how many actual cases would have qualified under this rule as a result of an enhanced first-degree misdemeanor charge based on the amount of high value of calls that cases that UH have seen?
Can you answer that?
I cannot answer that.
Okay.
Exactly.
Thank you.
And so none of us can answer that, right? But at the end of the day, we're saying that this is going to protect and this is going to help make people in the healthcare field feel more secure, but we have not really talked about or really got a real clear sense of how the workplace is going to change to the culture to help support the initiative. Meaning, we can't just say we want council to pass an ordinance to support healthcare workers. All of us at this council believe that wherever you work at, you should be protected, you should be secure, you should be able to work and go home and be safe. But if we're seeing a lot of people report things, and then you see a little bit of no prosecution, I don't know how 1380 is going to stop whatever issues that you're dealing with. If you don't have mandatory reporting as a top priority, then who am I supposed to say something other than to their partner or their significant other when they go on through the chair? This is more so us not just saying we want to pass legislation. I'm all for supporting healthcare workers. but I need to know whether this ordinance is actually going to change the outcomes. If thousands of incidents are happening, but only a handful become charges, then the council must ask whether this real gap is prevention, reporting, prosecution, or workplace culture. We can't keep trying to pass things, like I keep saying, for these little headlines, but at the end of the day, this is just a small part of it and call it a safety. Healthcare workers deserve accountability from offenders, but they also deserve accountability from the system that employ them. So as we talk about these 3 healthcare providers, if you're saying 1380 is going to do the job that you are asking, I tell you, you come back to this table and saying we need to change something else, I'm going to chew your heads off
Okay, Councilman. Thank you.
about the fact that I told you that we need the workplace environment to change. People in the job should not feel that they don't have to report. If somebody is being menaced, if somebody is being assaulted, if somebody is being threatened, that should be mandatory reported. And you should do everything in your power to make sure the employees are taken care of. So while we're past this ordinance or not, I want you to understand, if workers are not being treated fair and they do not have to report things, then don't expect them to make more reports. So therefore, the Cuyahoga County will not be able to prosecute anything if we're not actually taking steps to make sure people know that it will not be tolerated. And I yield, Chair.
Thank you. Councilman Jones?
Mr. Chairman,
You want to briefly respond because we have other legislation we have to
Yes,
address.
sir.
Councilman Jones.
I want to say, as a registered nurse now for 27 years, my duty has always been to serve patients first
Yes. Thank you.
and report incidents against myself last. That is why. This is a nationwide crisis. We are here locally to ask for support, to support and move things forward in the right direction, not isolated, but together.
Thank you. Thank you. Councilman Jones?
Thank you, Mr. Chairman. The chairman has eloquently stated the position of the chair as well as a number of members of Cleveland City Council when he asked the question he asked you, and I just want to say thank you that that your organization, your institution will be working, and I'd like to hear that from the other institutions here because I want to make sure that I'm in support and giving you the necessary tools that will enable you to be successful in dealing with this crisis on the national state that it's at. So, but the issue would be for the other providers as well. So I want to thank University Hospital for your comments as well as for you making sure that you are addressing the issue of the chairman and making sure that those healthcare workers don't have to be on their own personal time to make or file the incidents, that your institution will be working with them to help them in that process. So I would like to also know if the other institutions are going to be doing the same. And I do want to hear from them, Mr. Chairman.
Thank you.
If they're going to be doing the same, will they be able to come to the table?
Anyone here from Cleveland Clinic? Metro would care to comment briefly as it pertains to, do you support your staff who are victims? And identify yourself at the table. The young lady to my right, to the left of the safety director.
Hello, my name is Ashley Withrow. I'm with the Cleveland Clinic. I'm the director of the Center of Workplace Violence Prevention.
Thank you. To the right, to my left. Pull the microphone close and make sure it's on green. There you go.
Good afternoon, Ramona Brazil, Executive Director of Government and Community Relations at the Metro Health System.
At where?
At where?
Metro Health.
Okay.
We had a question.
Keep going. The young lady.
Good afternoon, Debbie Southerington, Chief Human Resources Officer, Metro Health.
Okay.
Good afternoon. I'm Joe Greiner. I'm the Chief of Police and Director of Public Safety for Metro Health.
Okay, Cleveland Clinic, you're up.
Thank you. I appreciate the opportunity, Chair, to the council members. We have many of the same measures in place as University Hospital described. We have emphasized prevention, response, and recovery as a priority across the Cleveland Clinic enterprise and have set action plans across the enterprise as well as for all of our hospitals and down to our highest risk units. We're focused on workplace violence prevention through our de-escalation training and our trauma-informed care training that is available to all caregivers. The Cleveland Clinic
Go ahead.
continues to invest resources internally, and part of that is in recovery from workplace violence incidents. And to your question, we have a lot of resources available to provide support to our caregivers that experience workplace violence, regardless of whether they choose to pursue criminal charges following that incident.
If they choose to file charges with the prosecutor's office, do they have to use their personal time, sick time, or vacation time?
When the caregiver files criminal charges and there's a court case proceeding in which they're subpoenaed, that time is not required to be taken out of their PTO.
But when they go to the prosecutor, when they
Right.
physically go to the prosecutor, is that time that they have to use their personal time?
Our managers work to keep their pay whole through schedule changes or offering flexibility. If they choose to use PTO to go to the prosecutor's office, at this time, that is not paid separately, only the subpoenaed hearings.
Okay, I
understand.
I want to state
I-
for the record where we're at, because some employees might be afraid to go because they don't believe they're being supported, and I want to make that clear here. If an employee needs to be transported to the prosecutor's office, then I would hope that
Yes.
Cleveland Clinic
Yes.
Security would transport them.
Yes, we provide a lot of support to our caregivers. We have our protective services and Cleveland
Okay.
Clinic Police Department that will support them through the conversation with the prosecutor's
Okay.
office. We also have a victim advocate program in which the advocates accompany our caregivers to court anytime they have to go related to a workplace
Thank you.
violence incident.
Thank you. Metro.
Thank you very much, and much like our hospital system colleagues.
Hold the mic up, dear. Very close. Okay.
Yes. As much as our other hospital system colleagues, we believe in a comprehensive continuum across the spectrum. It has to begin with prevention and then how we respond and support our staff. I am going to let our Chief HR Director talk about what some of those supports look like.
Identify yourself again for the viewing public.
Hi, Debbie Southerington, Chief HR Officer with Metro Health.
Okay.
Thank you for having me here today. We do support our employees. When there is an incident, we have immediate response team, including our HR business partners, our employee assistance program, our Metro Health Police Department. If an employee needs to take some time off, we give them 3 paid shifts, time off after an incident, and support them through the process of ensuring that their well-being is taken care of and that they are able to perform their functions accordingly.
So when they go to the prosecutor's office, I want to get, if they're menaced at noon and they go to the prosecutor's office, do they have to use their personal time, sick time, or vacation time to go to the prosecutor's office?
So at Metro Health, all crimes reported, either from employee or visitors, a police officer or detective meets with that person, the victim of that crime. We do file the report. We take that report. We present that to the prosecutor, whether it's the
Yes.
city or county, and then the prosecutor from there determines the charges and stuff that they move forward on this. So we handle all that for the victims. If there's any follow-up with them, as Ms. Southerington said, that they will will provide assistance if they have to meet with the prosecutor or anything like that. But we handle every crime that's reported at all facilities.
You transport the employee to the prosecutor's office.
So the employee is not transported to the prosecutor's office because we have filed a report like any police department does and files a report. We file the report with the prosecutor's office for that victim.
The employee does not have to go.
The employee does not have to go.
Okay. I want to make that clear to all the
I'm sorry?
institutions here that we've got to support the position of council. We want to support the healthcare workers. We all know the challenges that you're confronted with, more so than ever before. We want to make sure that they're supported, that they don't feel that that they're on their own, that they have no backup, nobody behind them. And we feel very passionate about it. So, and again, to my colleagues, so I'm going to, we got these other pieces, Councilman Conwell.
Mr. Chairman, I still have the floor.
Well,
I wanted to bring them up so I can hear if they have it, but I do have a
Okay,
question.
then wrap it up, Councilman Jones.
And I was, Mr. Chairman, I
Go ahead.
appreciate you as relates to this whole piece and
Okay.
making sure that there is that support for our healthcare workers in the city of Cleveland. And I want to thank the 3 institutions who are here and the work that you do for Clevelanders. And I'm appreciative of the World Healthcare Services that you all provide us. You may have heard me comment previously in other sessions as well as today, my concern for your customers coming into your emergency rooms. And this is really important to us because we haven't took to the picket signs yet, and I don't want to do that. I just want to say that some of your facilities, and I've been in a number of your facilities, I do appreciate Ahuja because I've seen some of the changes that they have made, and they have great customer service. I've had an opportunity to deal with a number of our constituents, which are all senior citizens. And so we have a lot of people going to the hospital. So my hat's off for some of the services, and I'm quite sure all the other institutions who are here also provide those same types of services. But what I want to make sure I express here, Mr. Chairman, and to my colleagues who are sitting here at the table, when we get sick as human beings, and we have to come into your emergency rooms, we want to be able to come into emergency rooms where it's clean. You're considering dealing with whatever those issues are from your previous customers who you may have heard me talk about. I've experienced some really bad conditions at Cleveland Clinic in their main facility that represents the city of Cleveland. And as an elected official, as a father, as a husband, we have continued to stay in our city. We love our city. And we want, especially for Cleveland Clinic, as well as all the other institutions, to make sure that their emergency facilities are appropriate. And if you have long wait hours, maybe think about creating systems where people are not waiting 12, 13, 14, 15, 16 hours in these waiting rooms. I've been one of those people who have been in the waiting room for long periods of time, so long that I took the needle out of my arm and left. And so I shouldn't have to feel that way after being there for 8 hours and not getting any service. So, Mr. Chairman, we may even have to talk about how service is provided to our citizens and our customers here. So, but with that, I'm not trying to propose any legislation. I'm just hoping that you keep your facilities clean. And with that, Mr. Chairman, thank you. I yield. And I'm in support of the legislation, so I'm ready to pass it.
Councilman Conwell?
Thank you very much. So, a point of clarity, when they go and they file a police report, you don't dock them and pay. Is that correct? Is that what I heard?
Whoever
And
can
that's
answer
correct.
that.
That
That's
is
correct. They
correct.
file the report in.
That's correct. And that's
That-
correct what you are.
Yes, our Cleveland Clinic police respond to take the report.
So sometime you go through a hearing, and you need to know anyway, it would be nice to send someone with them so that you know how to do prevention in Cleveland Clinic through the chair as well as with Metro Hospital. So, because your job, as you already know, is to protect employees, customers, and vendors. 3 things you have to protect: customers, vendors, and employees. So you want to know so you could do prevention so it won't happen to another employee. Do you send someone with that employee to try to seek to understand what's going on? And to Metro Health, and I'll yield and listen to Cleveland Clinic. Human resource manager, or
So the clarified question is, so if the victim has to go to court to testify, do we send an officer?
Or just when the police is doing their investigation, because you do an investigation, you go to seek to understand what's going on. Your employee or vendor, whatever, was attacked, and so you could understand what's going on. So through the chair, so that you could do prevention. Do you send anyone with them? Because I don't want someone to be attacked and then it happen again and again, and you put it down for reporting. Some of this stuff is through prevention. Is that correct?
Can you answer that? If not, we'll move on.
Through the chair to the councilman, if I'm understanding your question accurately, we will support the employee. If there is an incident and the police have to respond, a manager will be there as well as an HR person to help support that employee.
Thank you.
And it's more than just support human resource, it's trying to do prevention as well, so it won't happen to
That's right.
Ramona.
So we'll do an incident response, and we'll review the response to make sure that there's controls in place moving forward to prevent those incidents from happening in the future.
All right,
Yes.
and then let me say this, and if they had to go to court, are you going to dock them with pay or whatever that is, or do they have to use, someone mentioned, what was that, PTO? Yeah, do they have to use that time? Because you gather that time up. I don't understand that acronym, what it's for. Do you make them use that time, or are you there to support them, and you get to document?
Through
We
the
are there
chair,
to
through the chair,
support them.
please.
Through the
Yes.
chair, I'm sorry.
It's
I'm
all right,
sorry.
it's all right.
Yeah, we're there to support our employees. They do accumulate sick and vacation time, so we will enable them to use their paid time off, if you will, as the other systems do as well.
So what if they don't, what I'm looking at through the chair, it's going to benefit mental health as well, so you will know, so that you could do prevention. Why do they have to use their PTO, their paid time off? It's going to benefit you. You're going to take that documentation. You're over human resource through the chair, and your job is to do prevention, is to protect, as well as the chief, is to try to make sure that it doesn't happen again. So you can seek to understand, to protect employees, vendors, as well as customers. Through the chair.
Response
Through the
from
chair,
whoever.
Through the chair to the councilman. All instances where we track, we do security assessments constantly throughout the year. We watch what's going on, whether it's in the EDs, the other facilities. We check crime reports of the area, and we adjust our security and how we respond to things constantly throughout the organization. So we are always constantly tracking data from any type of, whether it's a crime against person or crime against property, and security assessments are constantly being done.
Thank you.
So, through the chair, why would you make someone, if I heard it correctly, take time off? Because you're going to have someone there, it's going to benefit, you're going to do prevention with that data. You're going to do, through the chair, you're going to do prevention, what you just said, you do a security checklist, right? So why would you dock that person pay? Because you're going to take that information to do, to protect Metro Hospital as well.
Through the chair to the councilman.
Okay, let's get
Through the chair.
clarify that once and for all. Are they using their personal time, or are they being covered?
They're being covered.
They're being covered.
They're being
Yeah,
covered.
they're written through the chair to the
Mr.
council.
Chair, they're being covered.
May I answer? Yes.
Yes.
Yeah.
Their written information
Yes.
says that they have up to 3 shifts of administrative leave that does not reduce an employee's accrued time. So
Very
Metro Health does provide that if they're seeking to press charges.
Thank you.
Right,
Thank
they're
you.
seeking a person.
Councilman?
That's cool.
That was
Are you
it?
guys the same way?
Yeah, I
Through the
state,
chair. I'm sorry saying
That's
you
all right.
guys. 'cause
through
you-
the chair to the council member, yes, I stated that for our caregivers, we are working to support them comprehensively. There are caregivers who choose to pursue the criminal justice system and those who do not. When they choose to pursue charges, we support them through programmatic resources like our victim assistance and our Caring for Caregivers program. Administratively, our managers are highly supportive and engaged, as are our protective services and police department teams. When
Thank you.
they have to appear in court, they are accompanied, and when they are subpoenaed, they are paid outside of their personal time off.
Thank you.
Yes,
Okay.
thank you, Chair. That's what I was
Thank you.
getting to right there.
Okay, finally,
Thank you. And I'm
Councilwoman
finished with that.
House Jones.
Sorry, I didn't mean to holler at you.
Councilwoman?
Yeah, through the chair, to the team members that are here, the question I've asked, and I don't know if there is a medical professional available, but I asked the question, what happens to a person when they are in an active state of trauma? Can anybody answer that question?
Is there anyone that can answer that? Because I'm going to be in a state of trauma pretty soon if I don't get this done. Okay, keep going here.
Well, no, the reason why I'm
Okay.
asking,
Okay.
again, no one has asked that question, but again, when there is a report, at least from the National Institute of Health, that talked about when people are in an active state of trauma, there's something called emotional deregulation, which means they are not able to necessarily control what they do. And that's one of the reasons why I just am not in support of this legislation, is because when people are in an active state of trauma and they're in a hospital system, I just think that where else do you go when you are experiencing trauma? If you can't get the support from the hospital system, and then you're penalizing for them, I think it's just very troubling. So I just want to make that, I just want to make that known, because again, if you can't even get help in a hospital system, people are just doomed.
Thank you, Council Lady.
I
Okay.
would feel comfortable at least trying to answer that question. So through the chair to the councilwoman. Myself, I am also a registered nurse and have been one for 25 years, although that's not my current role at Metro Health. So we are very understanding. We deal with some of the highest acute settings, certainly in the trauma center, in the jails, in the shelters, in our behavioral health hospital. Most caregivers, which is part of why there's a disconnect on pursuing charges or not pursuing charges, is because we see these things through a clinical lens and not necessarily a criminal lens.
Okay,
And
thank
so
you.
part of what we want to do in that situation, of course, is to de-escalate what is happening. We also have to understand what someone is going through. There was a recent study of about 500 nurses that when they were posed with what would be considered to be an assault, a situation, most of them would decline to pursue charges. So I know we've talked about, whether or not it's the workplace or if it's kind of the culture, but we come into healthcare because we want to help people. So it's through that training, but it's also through understanding what people are going through on how we help to de-escalate and how we ultimately respond.
Thank you. Okay, we've heard testimony at the table. This is our third lengthy discussion on this legislation. We've had sessions among council members to discuss the amendments. The legislation before us is 1380-2025 as amended. Madam Clerk, call the roll. Yes.
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 No.
Yes.
Thank you, my colleagues, for this extended discussion. I thought we were rewriting the city charter for a moment here. And I appreciate, and please sign it up. And I want to thank all the institutions who came here, Metro, Cleveland Clinic,
Good to see you, Vermont.
UH, and EMS, who did not want to testify, but they've informed me, are very supportive of the legislation. Thank you.
So is this finance or safety committee?
This is safety.
Okay.
Thank you. Go on. If you guys got to make a quick pit stop, go ahead.
I see the health chair relieved it out of their committee.
Right, exactly. He didn't want to deal with it. He wanted me to have to deal with you characters, all right? Okay.
Yeah, but we evicted you from the committee. Yeah, you get no outcome measures. You put Star. Nah, keep Star where you at. Keep Star where you at. Keep Star there. Well, Councilman, it's not just about being on committees. When you're a councilman, you're supposed to be able to venture off and elsewhere. If I see anything wrong in your ward, I'll come in and I'll help. I won't meddle, but that's what that is. It's not funny. It's about going in and helping, and that's what leadership is about. No, leadership is about you getting in there, you help too, and you roll your sleeves up. It's easy to laugh about something, but you got to get involved and work. No, let it. You sat on there. You sat on the committee also, young man. You sat on the committee too. So you always want to cast the blame on something. You was in there too. When I see leadership somewhere, I'll step in to work.
I know the safety director had to make a pit stop, and I think some of us, the rest of us do, but before we have to import a porta potty here, we're going to get going here.
I haven't read them.
Okay,
This is a leader.
Madam Clerk, do we have a quorum? Thank you. We are starting with ordinance number 593-2026 by Councilmembers Polensek and Griffin by departmental request, an emergency ordinance authorizing the Director of Public Safety to apply for and accept a grant from Cuyahoga County for the fiscal year 2025 Urban Area Security Initiative Grant. Director and Dawn. And again, introduce yourself for the viewing public that hasn't fallen asleep after this last piece of legislation. Okay?
Yes, Chair. Wayne Drummond, Director of Public Safety.
Thank you.
To the Chair, Dawn Hartsong, Public Safety Grants Coordinator.
Okay. Director?
Yes, sir. The purpose of the grant and the goal of the Urban Area Security Initiative Grant Program is to provide funding to enhance regional preparedness and capabilities in designated high-threat, high-density area with a focus on planning, equipment, purchasing, and exercises. The Department of Public Safety will use the funding for EMS.
Wait a minute, Director. We cannot hear, please. Take your conversations outside. Thank you. Go ahead, Director.
Yeah, the funding will use for the divisions of EMS, fire, and for police equipment. The amount for the grant is $659,479. For Cuyahoga County will purchase all equipment and will transfer the assets to the City of Cleveland. The grant term will be determined by FEMA. There is no local match, and the grant dollars will be spent as follows. For EMS equipment, it'll be $92,400. For mass casualty incidents, which are for helmets and response kits.
Okay.
And also for fire, it'll be $180,774. That's for rapid deployment kits. And for the Division of Police, it'll be a total of $256,000, and that's for our traffic barricade systems. And that's basically when we have special events, we'll have the barricades to use versus using salt trucks. We can put those back in service.
Okay. Dawn, you have any comment?
To the Chair, this is a grant that our region usually receives annually. It's based on a formula, so we know how much money is coming to the region, and
Okay.
it goes through the state, the federal government to the state, and then to the county and to us.
Okay. No cost to the citizens of Cleveland.
To the Chair, that's correct.
Okay. Any questions of the committee?
No.
Without objection, the legislation stands approved as read. Please sign it up. Okay. Ordinance number 613-2026 by Council Members Polensek and Griffin by departmental request, an emergency ordinance authorizing the Director of Public Safety to apply for and accept a grant from the Ohio Office of Criminal Justice Services for fiscal year 2026 Violent Crime Reduction Grant Program. Came to us on May 11th, 2026, approved by Director of Public Safety, approved by Director of Finance. There is no legal objection to the legislation as proposed. Director and Dawn.
Yes, Chair. This legislation would authorize me, the Director of Public Safety, to apply for and accept a grant in the amount of $272,399.58 from the Ohio Office of Criminal Justice Services for fiscal year 26 Violent Crime Reduction Grant. The purpose of the grant and the goal of the Violent Crime Reduction Grant Program is to provide funding for the prevention, reduction, and elimination of violent crime through the use of proven strategies. The Division of Police will use a multi-jurisdictional approach that incorporates focused deterrence, place network investigation, hotspot policing, and violent fugitive apprehension, supported by crime analysis and multi-jurisdictional task force operations. Grant term and amount. The grant amount I've already mentioned, and the term is from January 1st of this year through December 31st of this year, and the dollars will be spent accordingly. Personnel, $231,400 $49.58. That's for police overtime equipment. $41,350. That's for throwaway robots, computers, bumper guards, for the total that I mentioned before. Grant period again is from January of this year through December 31st of this year. This is a new competitive grant. There's no local match.
Okay. Don, care to comment?
Sure, through the chair, this is a brand-new opportunity. It was a competitive grant put up by the state, so this is the first time we had the ability to apply for it, and we're happy to accept the funding.
Okay. Questions of the committee?
Council President.
Yes, Councilman Slade.
There's a typo to amend so I move in section 1. It's listed sections 601.01. It should be 604.01. It's 604 throughout the rest
Okay.
of the ordinance.
Okay, did the Assistant Law Director get that as well?
Where's that?
So be it
Listen
ordained
up.
that the council, and then section 1, the following sections of the codified ordinance 1976, and then it says sections 60101, and then continues on with 604. Everything's 604, but here it accidentally says 601.
Okay, do you understand? Jason, would you care to sit at the table rather than whispering? Okay, okay, I know, whisper. Assistant Safety Director, say what you have to say.
I believe that's for the dog ordinance. That's
Yeah, I
the
don't
next
see
one
it.
up.
Okay, that's,
Oh, sorry, you're right. I am on the wrong
Yeah,
one.
yeah.
You're
No,
ahead of the game.
I read the wrong one. I read the wrong one. I read the wrong one.
Yeah.
Can I start
Okay.
over?
yes, you
All right.
can.
I'd like to make a different amendment. This is the one for the cooperative purchase. The Director of Public Safety shall provide notice to the Clerk of Council whenever any purchase is made through the cooperative process, which notice shall include the details of such cooperative purchases to be inserted at the end of section 4.
Okay, there's been a motion made. Is there a second?
I'll second.
Thank you. Questions on the amendment? All in favor? Aye. Opposed? Amendment is approved. Director, any other comment on your piece of legislation?
Not for this one, no, sir.
Okay. Without objection, ordinance number 613-2026 is approved as amended. Please sign it up. I know. As our last piece, hallelujah, okay? Ordinance number 605-2026 by council members Polensik and Griffin by departmental request, an emergency ordinance to repeal all sections in Chapter 604 of the codified ordinances of Cleveland, Ohio, 1976, as enacted and amended by various ordinances relating to dogs that pose a threat to public safety, and enact new section 604.01, 604.02, 604.03, 604.04, 604.05, 604.06, and 604.99 relating to nuisance, dangerous and vicious dogs, was read for the first time on May 11th, 2026, approved by the Director of Finance, approved by Director of Finance. There's no legal objection. I don't see any dollar amount in the piece. We have our head of the animal control here, Mr. Campbell. The floor is yours.
Through the
Or
chair,
whoever would care to comment.
Through the chair, if I can introduce my team, and I'm sure they can introduce themselves. You have Jason Shackner to my right, Assistant Safety Director, Bruce Campbell, who's the manager of the Animal Care Control, and then Rachel Bryant, who's the Chief Animal Care Control Officer. So they're here to comment on if there are questions on the legislation. But Jason Shackner is going to walk us through the request.
Okay. Tell us what this is, because obviously you know that council over the years has taken action not only about vicious dogs, but also animal cruelty. This is an issue we feel very strongly about, so tell us what this is.
Thank you, Chair. What this ordinance does is essentially repeals our current regime of dangerous dog designations, which is idiosyncratically called dogs that pose a threat to public safety. We have level 1 threat and level 2 threat designations. Now, what happened recently and became effective on March 20th of this year was the passage of Avery's Law, or House Bill 247, which revamped the dangerous dog designations that are statewide under Chapter 955 of the Ohio Revised Code. This was in response to an 11-year-old who was injured and severely injured by a dog attack. So the purpose of that statewide legislation was to add stricter penalties, misdemeanors, and even a felony level offense. Was also allow for the destruction or euthanasia of a dog if it meets certain parameters. A court could order that. So what we want to do, and I'll read some of this here, is that
Okay, go ahead.
this legislation really is necessary to align our local ordinances with the framework and amended our framework of House Bill 247 and our ORC Chapter 955. So under the new Chapter 955 as amended, the statutory authority to designate a dog as a nuisance, dangerous, or vicious dog is vested in the county dog warden or other authorized person under RC 955.23. So Cleveland Animal Control Officers or municipal Cleveland Animal Control Officers do not have that authority to designate dogs under the ORC regime. Only the county dog warden or deputy dog wardens or sworn law enforcement officers have that ability. So the issue that has been, and it has been county-wide, because we're a county with 88 municipalities and each can have their own dangerous dog designation regime, is that our prior dogs that pose a threat to public safety is only applicable within the city of Cleveland. So that means if someone could just pick up and move across town to Lakewood, to Euclid, to Solon, and that designation disappears. All those requirements that are put on there don't apply anymore, and we have seen cases, and the county has seen cases where that dog goes off and bites another person, and there's no escalation of penalties because it's like the first time. And what this does is makes it applicable statewide. So if the county does the designation, that designation follows them everywhere in the state. So all those requirements that are in county
Would the
law.
county folks like to come to the table? We don't,
know they're
you've sat here
nervous.
through the grueling previous legislation, so we'd like to come to, there's seats over here too. You can come over here, don't be bashful, come down here. Come down here, be in a line of fire along with everybody else.
Sure, you know we passed through already, right?
I know that. So that's basically your presentation.
The gist of it is that basically we create a regime where our ACOs are going to be the first responders. They're going to take the initial reports. They're going to forward that over to the county. The county is going to make the designation so that it applies statewide. There's also further protections that while that designation is pending or investigation is pending, there are certain requirements on the dog owner to keep that dog in a manner that a dangerous dog under the law would be kept. So that's muzzle requirements, that's leashing requirements, that's fencing requirements.
Is there something like a bulletproof, something you can provide members of council that we can have a better understanding that as we go to our neighborhood meetings? So I guess my question to you is this. Councilman Starr has a vicious chihuahua, okay? Okay, that's why I know that. I know that, that's right. So I would still call our animal control, but our animal control could not take that dog under the legislation.
Well, yes, under the legislation. So there are there's a circumstance where a animal control officer can impound the dog if it meets one or both of certain requirements. They would have to, under the totality of the circumstances, okay, let me read the whole thing. So
Yeah,
I'm
go
just
ahead.
not like
Just
tripping
so the
over
viewing
myself,
public
you know.
has a better understanding.
Yeah, so the summary basically establishes seizure authority where an animal control officer has probable cause to believe a dog has committed a nuisance, dangerous, or vicious dog act, and either one, the totality of the circumstances renders continued possession by the owner unsafe, or two, the act resulted in the death of or serious injury of a person.
Okay.
Because then they could seize the dog. if that
Our
occurs.
our people could.
Our people could, yes.
Okay, but if it's other than that, then they would notify the county, correct?
They could either notify us or the county. the impound requirements are, this is modeled after the revised code.
Okay.
So it's the same authority that the county dog warden would have. So we just, some of the things that we believe that our ACOs should have authority to do, we match that.
Okay.
And something, like specifically the designation part, we didn't want to duplicate because then those designations done under the city by our ACOs would only be applicable to the city.
Okay. So, in essence, to the viewing public in layman's terms, we are attempting to mirror state legislation locally.
In a way, yes.
Okay. In a way, yes.
Yes and no.
So, if I would be remiss and disrespectful if I didn't ask who's here from the county. Tell us who you are.
Deborah Conway, I'm the Chief Dog Warden.
Chief Dog Warden.
Reed Stefan, I'm an Assistant Law Director.
Okay.
No.
I'm with the city. Mindy Naccioni, Animal Shelter Administrator.
Okay, for the Cuyahoga County. Okay, would the county folks care to comment? We want to be respectful to our county partners.
Thank you for having us
Okay.
here. Oh, this one isn't.
Okay. Okay.
Thank you for having us. We're really here to say we are in support of the legislation changes that the city is proposing.
Okay. And as we have said before at this table to the dog animal control, Mr. Campbell is in charge of animal control. If there's anything, we know that the animal problem in the city is a people problem. We all know that. The people who don't want to take care of their pets, who don't want to care for them properly, don't want to feed them, don't want to we all know, we've all dealt with it. I've dealt with it longer than anybody because I'm here longer than anybody, but I just shake my head when I see the condition that some dogs and cats are put in and put through. It's appalling. It's disturbing me as a former pet owner. I lost my lady girl last June, and I still haven't recovered from that. Losing that thing, and that's why the coyote's back in my yard again, because lady has disappeared. But the fact of the matter is, we say to you again, if there's anything where you think we need to stiffen laws in the city pertaining, again, animal cruelty, provisions, etc., we want to make sure our kids are safe, our citizens are safe, especially our citizens and children walking our streets. And we want to hold accountable individuals who are contributing to the problem in the city. So is there any other comments from the administration?
I'll just say to the chair that we have a package of legislation that will be forthcoming, probably introduced sometime this summer, but could be heard in the fall, that initiated by Chief ACO Rachel Bryant, that addresses a lot of those prevention needs.
Okay.
So it's coming, Chair. It's coming.
Yeah.
Yeah.
Okay, any questions of the committee? Okay, okay, Councilman Slife, you have an amendment.
This is the one that I wanted to do first. I move to strike in section 1, 601.01 and insert section 604.01.
Okay, which should read as such.
Pull that up. So currently it says, it lists all the affected sections, which are all section 604.
Okay.
It erroneously lists section 60101 instead of
Okay.
60401. So
Thank
it'll say
you.
that the following sections of the codified ordinances of Cleveland, Ohio, 1976, section 604.01, and then proceed as written.
Okay, Assistant Law Director, do you understand that? Yes. Okay. Questions on the amendment? Madam Clerk, okay, excuse me. All in favor of the amendment? Aye. Opposed? I have it. The amendment passes. On the legislation, any questions on the legislation? But don't go away, guys. I got concerns for you. Okay. Without objection, ordinance number 605-2026 is approved as amended, and to our county partners, thank you for coming to the table. Now, gentlemen, here's the legislation. Now, gentlemen, do not, and ladies, do not go, I'm not talking to county. I had some disturbing phone calls today saying that with regard to the pickup of groundhogs and raccoons, our citizens are being told they have to pay for that now, $60. I've had 2 calls already today on that, saying that they are told by the vendor that they have to pay $60 if they want quick pickup.
Quick pickup, not pickup, quick.
Quick pickup. Now,
To the chair, I've not heard about this. I will say that there are strict requirements for the people in the public to be able to qualify for this program, because we're trying to rewire people's minds to not think that we need to kill all of the wildlife that's in the city. We need to learn to cohabitate, because we're never going to get rid of all the raccoons. We're never going to get rid of all the groundhogs. So they do have a system set up, and it is a first come, first served basis for those that qualify. I would have to ask the provider what this is regarding, but I would venture to say that this is somebody who does not qualify for the program, and they're wanting service. So in that case, they would be responsible for doing it on their own dime. Or it could be that they don't want to wait because they're going to have to wait now a couple of weeks before they're in line to be serviced, and they're trying to jump the wait list.
So,
Through the chair, can we check on that? I know you said, can we check on that? Okay,
You're
please, so
gonna
we
get
can.
the email. But what I'm saying
Let's check
to
on
you,
that.
when you came before us to go for an outside vendor, you told us at the table this service would be an enhanced service, that we would have additional pickup of, especially, we know the problem we're having with groundhogs all over the city. And I'm going to hold you to that, what you told us at the table, because we authorized and we passed the legislation. And I don't want to find out after the fact that some of our residents now are being told otherwise, that they cannot be accommodated. Now, I understand there's a great deal of demand put on your shop, especially, again, what we're all seeing. I mean, I'm looking at groundhogs, I'm looking at I've seen everything in my own yard except for a bear, and I'm waiting for that, okay? But I want to make sure, because I myself can deal with it, but that we have elderly folks who can't, and they need to get service, and they need to get those critters out of their yards, because they're tearing up their houses, they're tearing up their front porches. I've seen it, I've been into their yards, I've been to their homes. I just want to make sure what you told us again at the table, and when this, you're going to get the information. She told me she had to pay, she was told she's going to have to pay for that trap. That steam started to come out of my ears.
To the chair, I agree with you. That's a little disturbing to hear.
Okay.
And it does require us to look into that a little further.
Oh, you're going to get it.
And we are going to, and I want you to hold us accountable to this program. It is a pilot program, and it is something that we're working our way through, and there'll be some bumps along the way, but we are here to serve the residents with this program.
Are you monitoring the program?
Yes, we are monitoring the program. We just received our first biweekly report, and we're monitoring this every other week to find out what's going on. But I can tell you that we've trapped on 28 different properties in the first 2 weeks. We've trapped 34 groundhogs, 32 raccoons, 4 skunks. We did 9 single-point entries on residents' homes at no cost to those residents.
Okay.
We also did a multi-point repair in a home, but if we didn't do the multi-point repair, probably would have had just repeat offenders coming into that property, and they call Rachel, Chief Bryant, before those repairs are authorized. So this is a little disturbing to hear. But
okay, send us that information, your data.
Okay.
Based on the requirement contract that we passed. I want to make sure we're getting our money's worth and that our citizens are getting the service that they expect. And so I'll get you that information from the constituents that called me today, and because I was taken back when I heard what they told me. So any other questions for our director, assistant director, animal control? And who's the young lady next to you?
I'm Chief Bryant. I'm the Chief Animal Control Officer.
Are you new?
I am new. I replaced John Baird in his role.
John finally retired.
Yes.
After what, 50 or 60 or nothing?
Yes.
40 years. Okay, I wish we'd have known that. We would have got him a proclamation or something.
He did not want anybody to know he was leaving. He kind of wanted to do the Irish goodbye or whatever they call it.
Okay. So, but we still are to contact Mr. Campbell if we have issues. Okay, we'll do that. Any questions of the committee? I thank you all for about your chihuahua, or what do you got here? Okay.
No, my question, I seen that it was like since 1976, so you probably drafted this, babe, right?
No, I did not.
Okay.
You know, if things don't work out here, you can always go over to the comedy club. You might fit in over there better, okay? Thank you. Committee stands adjourned, okay?